Okay, we are live. Okay. Good afternoon, everyone. Welcome to the next installment of the Mail and Guardian webinar. Thanks very much to the kind sponsorship by Dr. Reddy to allow us to have these discussions. We're just waiting for everyone to join us today on our discussions around frontline and healthcare professionals and mental health during COVID. I can see everyone joining. We already have 342 participants. We're just going to give it a minute or two for everyone to join. I can see we have lots of people joining us from all over. We have Boksburg, Limpopo, Johannesburg, Sandton, Pretoria. Thank you everyone from wherever you're contacting and wherever you're joining us. Thank you so much for joining this discussion this afternoon. See, we even have people from Diepsloot and Durban. Welcome everyone. From even Botswana and Gaborone. Thank you. Welcome, Cynthia. Everyone's coming in, even the Vaal Park. We've got Paul. Alberton, that's always great to see from the east. Welcome everyone. Okay, I see everyone's still joining. We even have KwaMashu in KZN, Knysna, Cape Town, Bedford View. Welcome everyone. It's really great that everyone is joining from all around the country and even outside of South Africa, which is really great to have you join us today. While everyone joins us, I'm just going to do a quick intro and welcome just to set the scene. Today with me, we have two amazing experts that I get to work with very closely. So thank you so much for your time this afternoon to join us. On today's Mail and Guardian webinar, we're really unpacking the discussion around the mental health impact for essential frontline workers, including healthcare professionals, during COVID-19 and lockdown. This is an important conversation that we're hoping through today, it starts the discussion that opens up many more conversations outside this realm of the webinar. The lockdown that has come from COVID-19 pandemic around the world has been universal, and so many people have been affected, especially essential workers who are vital to the core functions of the economy and society. They've still been working throughout this time that everyone's been planning to stay at home, to bake banana bread and to learn new skills. These heroic essential workers, which include healthcare professionals, are braving the front lines every single day to help so many other people around the country, often risking their own lives and personal safety, which we're going to unpack today. Every day they go to work, they are faced not only with protecting themselves, but also people that they're looking after in their hospitals, clinics, or practice rooms. Today, I'm joined by two experts. We have clinical psychologist, Zamo Mbele, who's also a SADAG board member and a psychologist at Tara Hospital, as well as a private practice at Donald Gordon. We also have psychiatrist, Dr. Antoinette Murch, who's a specialist psychiatrist and has been very integral in creating awareness around the mental health of healthcare workers in South Africa. So today, we're going to really start and unpack the conversation, and I appreciate everyone from wherever you're joining. We have just over 450 people joining the session today, and I'm really looking forward to the discussion. What we're going to do now is just really talk and unpack it, and then we'll be answering your questions from the chat. So if you have questions, please, I urge you, go and post them. We will definitely get to them and answer as many as we can. And also in about 10 more minutes, we're going to post a new poll question, and I urge everyone to go and fill those in. And towards the end of the chat, we'll be able to release those results. So to unpack this important topic, I'm going to get right into it. Welcome. I think just to really start with this, perhaps I can come through to you, Dr. Antoinette Murch, about what is the brief background around mental health amongst essential workers or specifically healthcare professionals before COVID-19? Maybe you can just paint a picture for us.
Thanks, Cassie, and thanks for having me here for this really important topic. I think you've pointed to a very topical issue, and we've been speaking about it, and I know SADC has been doing lots and lots of work with the general public and healthcare workers in the past. And overall, it is not an area that is well looked after. So traditionally, it's not an area that is focused on. It's not an area where lots of funding goes. There are major divides in terms of the private and public sector, in terms of mental health, and there have been big problems. So in terms of COVID-19, I think it has allowed us, and we'll talk a bit more about that just now, to really gain momentum in thinking about the public mental health, thinking about essential workers and healthcare workers, because the mental health issues are more acute at this stage. So it was never really looked at in as much depth as I'd like it to be. And I'm hoping we can use this as a platform we need to support people now, but also to just realize that mental health, there is no health without mental health. And I think we're seeing that coming through in this pandemic.
And I think that's also such an important thing, is that, we forget that all these essential workers, people that have been working in grocery stores, cashiers, transport, police officers, emergency, even healthcare professionals, they've worked the entire lockdown under very different circumstances during the stress. And perhaps more, you can just unpack some of these stresses, the triggers that they're experiencing, and some of the personal risks that they're taking on during this time.
Yeah, thank you, Cassie. I mean, I think that there's a plethora, and we probably would need this entire hour and more to really be able to unpack some of the stresses that they've been. So let's start with where you start, with the fact that a lot of people have been working for the past X amount of days that we've been in lockdown. And I think that can be very easy to forget that while things are opening up and there's an easing up of restrictions, and we're going to see more of that where people are returning to work, a lot of essential workers have been working, in fact, during this particular period. So one of the things that we expect and anticipate at this point is already a level of fatigue. And that fatigue is not just because there's been, as I say, work until this point, though how they've been working has been incredibly stressful. I'll share to this extent that myself, driving around and having to work, especially in the first 3 weeks of lockdown, and then the 3 weeks after that, it was a lot of work. And part of the reason is that you're having to work under a new normal, and that requires a lot more energy and a lot more resources. I think a lot of the essential workers are not just having to do the work that they're doing in hospitals, at garages, or at malls, but they're also having to do the work of looking after themselves, which is a silent kind of work that can also be exhausting. That is an additional layer or level of work that they're having to do. Specifically, our healthcare workers. So it's not just that their caseload has increased, and it's going to increase. It's also, in fact, that they're also themselves working on the COVID anxiety. How do you keep yourself safe? And how do you introduce standard operating procedures that have never been there? A lot of my colleagues will speak about the fact that they've been doing clinical work, looking after patients, but also the work of trying to develop protocols or guidelines. And that is incredibly exhausting as well. So we can go on and on, though I thought it was quite important to highlight that and those. And maybe one more thing is to link to something Antoinette was saying, is also to appreciate that this work in South Africa, even before the COVID crisis, is already immense. And I think that's very difficult to really know until you find yourself in many ways already on the front line, is that we already have a system that is putting a great deal of burden on frontline healthcare workers. So I hope I've really painted the picture that exhausting is probably an understatement. Tiring is a real understatement, and fatigue with everything that's been going on is, again, something that is very difficult to appreciate at this point for that population.
And I think, having these conversations again, they haven't always been in the space, and we've forgotten these essential workers and healthcare professionals. And I think, also from your side is that you've both been working throughout lockdown and going to hospital and seeing patients, and perhaps and working with other colleagues, and even from the work that you're doing around creating awareness around mental health for healthcare workers and essential workers. What is some of your experience? What is the impact that you've already seen on the ground of COVID-19 of your colleagues?
So, I think I can answer that. In terms of healthcare workers specifically, but this applies to essential workers. I think if we go back, how many weeks is it now? 7 weeks, 8 weeks to the beginning of the lockdown, there was an absolute change in routine in everyone's schedules. There was change of rosters, there was cancellation of leave. So I know some of my colleagues especially in the public health sector, really stressful. There was cancellation of important events, weddings, and these are huge emotional triggers. And there's lots of missing and there's lots of loss during this time. So you're missing out on that normal socialization, which you can get if you're really busy at work and you come home and you get that. It's very hard. I found it hard, but it was very strange those first 3 weeks when I'd drive to work and I'd see like 4 cars. There was a bit of relief, like, oh, I can get out. But then also like, actually, I'd like to be at home cooking banana bread or something so simple. So I think for the essential workers who have had no choice, they've had to carry on, going to the garages, going to the shopping malls. It's been a long, hard slog. And then on top of that, we've got the uncertainty of the virus itself. So what do we do? What we did 2 weeks ago is maybe not what we do now. So there's constant changing information, and it's a very stressful, to put it very mildly, time. And the emotions as Zamal said, I think exhaustion is one of them now, but we've seen the waves of anxiety, waves of emotions. We started off with a lot of anxiety, a lot of anticipatory anxiety. Then some people, I suspect, would have hit that adrenaline spurt where they just work really hard. Then it becomes irritation and frustration, and then overwhelmed. And we're going to hit another, in terms of the healthcare workers, we're going to be hitting another spurt of adrenaline, where healthcare workers are going to have to push themselves. And it's about understanding what's coming and then mediating that. Because we do know without appropriate mental health intervention, and it's not psychiatric intervention, they're not having mental illnesses, but we need to help them with the day-to-day anxiety and just remind them to look after themselves, because healthcare workers, essential workers, they're by nature, let's serve. And at this stage in the pandemic, I am specifically encouraging people to look after themselves, because if we do not have essential workers, healthcare workers looking after themselves, we cannot look after the public, and that's really important.
And I think I want to come back to you. We've seen a lot of lessons happening from overseas and the experiences of healthcare professionals from countries like, China and the UK and US, and perhaps you can share some of those experiences and what we're hoping it to be slightly different in South Africa if we can address the issues now.
One of the fortunate parts that we must take advantage of, and I think to some degree we have been able to in several sectors, is to appreciate that we are a little bit behind in terms of the trend. So the way that I've spoken about it in recent times is to say, if this is a series, we are in season 1 and 2 to some degree. I think we're now 2 to 3, and other countries are in season 4, 5, and maybe potentially some in 6. And we have the capacity then to look ahead and to adjust as far as is possible in our current season, so that we are a lot more prepared. And that has been great to the extent that we can really do that. And one of the things that we need to do then is to harness, I think, as Antoinette is saying, the appreciation that we did not know that there was season 5 and 6 and 7 coming. those were bonus seasons, and not in a good way, though they're there. And that will help us appreciate how long this is going to be, actually, how much of a long road, and therefore to pace ourselves in how we are responding to this, particularly as healthcare workers. Because that adrenaline can last only a season in reality. And thereafter, we need to be pacing ourselves with what we have in order to keep going and to keep going in a huge way. One of the important messages or factors that I have seen in order to try and pace ourselves is that the appreciation of the anxiety, the appreciation of the fatigue too. To go back a little bit to something that you were asking, is that in terms of my colleagues, an additional fatigue point, and I think a point that might cross a threshold from a normal response to then something that's not so normal, is that everybody was looking to healthcare workers in a way that created this myth that healthcare workers are going to be stoic and calm and themselves are not going to panic. Now, from a psychology position, I think what that can do, and that does do, is that you almost then push back and push down your own anxiety, which is work to do that. And then you work to respond, I think, as the internet was saying. So again, you're doing double work. You're working to attend to what people need, though you're also working to push down your own worries and fears, which of course will come back again to a degree. So if we're going to respond to this in a way that, again, my colleague was saying, that says that, how do we say that this is normal and it's actually not psychiatric, and at the same time it needs attention? That is exactly part of the attention that we need to give to. If you can attend, in fact, to the worry and the concern inside of you, it actually really does allow you a long-term capacity to deal with it all in a huge way. And I think that's fortunately now kind of being detailed in the research that's coming out from the other countries who have dealt with this. And we absolutely need to then disseminate that information that we have.
And I think that's so important, is kind of also remembering that the essential workers and our healthcare professionals are also people, and they've also got their own stresses. They're also navigating through COVID and lockdown themselves, and not just having to be there as the go-to for everyone else that comes to them and says, help us, and you fix it, and what's happening. And I think we underestimate that they didn't get the time to have breathing space, to prep, to digest everything. They were have just continued working. And I think maybe, Zam, if I can come back to you, what are some of the symptoms that we should look out for if someone is feeling overwhelmed or anxious or stressed, especially for loved ones? And I see some of the questions already coming through, is how do we as loved ones identify if our essential worker or healthcare professional is perhaps not coping? What should we be looking out for?
I think that there's a plethora of things that you can look out for. So let's start with when things are probably at the peak of their anxiety. And oftentimes we know that when a person is really preoccupied or anxious, when they battle ready, you get to see how much energy they're exhibiting. So that adrenaline that we were referring to later can actually be obviously very productive and very helpful, though it looks as if it's preparing you for something, and at the same time it's consuming something a lot inside. So what we almost want to look out for, if I can coin something, is combat readiness that does not subside. Somebody who's always kind of on the edge, always ready to respond, and always feeling like they have a lot of energy in a pervasive way, in a way that doesn't rest actually and or switch off. And then soon enough, you're going to start to see the crash of that. And the crash of that comes in with particularly when the crisis is there and the fatigue is there, a great deal of irritability, a great deal of impatience, a whole host of kind of tempered responses. And related to that are then the generalized either anxiety and depression symptoms, things like difficulty or shift in sleeping patterns, specifically people not being able to sleep, people not looking after their physical health, people not even eating in a way. And those are then really important symptoms to try and catch. So we do expect that there's going to be a change and shift in behavior, emotions, and thoughts. However, if those shifts in behavior, emotions, and thoughts are A, extreme, and I think B, they're lasting a long time and are not responding to have a cup of tea, sit down, then we need to start being quite concerned.
And I think, some of the specific stresses or triggers in the South African kind of frontline sector are quite different. Our resources were already under strain. We didn't have enough of healthcare professionals, not enough doctors, not enough nurses. What, from you, Dr. Antoinette, what are some of the other stresses from a personal level that our essential or frontline workers are dealing with that's perhaps making their working environment difficult or even their personal lives? I mean, what are some of the trends that we're seeing at the moment?
So I think the big trend we are seeing is across all frontline workers, including healthcare workers, is they cannot get away from it. So it is everywhere. It is on their way to work on the radio. It is at work. They're talking about it all the time, and then it's at home. And it's personal, and that's what makes this disaster or crisis situation worse. It is affecting them in every single area, and I think essential workers and specifically also healthcare workers, I think people do forget they're humans first, and they are worried about their loved ones. I've got colleagues who they are worried about their kids' education because they haven't been able to sit there and go through piles of worksheets or anything that the school has had because they're working. And they're worried about older family members, they're worried about vulnerable family members, they're worried about contracting the illness and bringing it home. And the guilt associated with that is huge. They're also worried, I think I'm using the word worry quite a lot, but I think it's so prevalent. They're also worrying about infecting patients, because what if they are symptomatic and then they accidentally infect a patient or infecting their colleagues? So there's a lot of anxiety and worry, and it is much more personal, and that's what makes this condition, this situation very hard. The other thing which is happening, and I see it's happening a bit more now, is there's a lot of uncertainty and rhetoric in the press, and then this is going to happen and this is going to happen. And I think, this is also where responsible journalism needs to step up. You can create a lot of panic in the community by sensational headlines. And it's about, our team is promoting the concept of capable calm. And we promoting it across the sector, but we need to watch the way the information is getting out. And if you're finding yourself specifically anxious and overwhelmed, you need to get off social media. You need to, only stick to one news source. So, healthcare workers are dealing with this at work, and then they're dealing with it at home as well. And at work, some healthcare workers, it's coming more now. They're being asked to do different jobs than they are used to. They're being asked to join COVID teams for a week and then off the team for a week. And this is going to create a lot of tension within them.
And I think that's a really good point. It's even popped up on the chat already, where, Gillian is saying that in reality, many doctors and nurses and healthcare workers in public hospitals are being overwhelmed with additional demands, and their job responsibilities have increased because we're dealing with so much. And I think, one of the things that has been in mental health for so long, and SADAG has worked, been around for 26 years, and there's still so much stigma around mental health and just talking about it. And I think especially on our frontline workers, amongst healthcare professionals, our police officers are told cowboys don't cry. Doctors are told that, mental health is a weakness. So there's this stigma that they can't really say, hey, I need help, or I'm not coping, or I may be very anxious or depressed. Let's maybe just unpack some of that stigma specifically in the sector, and why there's a stigma, and what do we do to try to tackle it?
Again, I think that it's one of the topics that we should spend so much more time on. As you say, in terms of as advocates of mental health, one of the things that we know is that emergency services, doctors, police, there's no space to admit vulnerability. because oftentimes those are the types of jobs where you need to be the strong one and the hero. And what a pity, in fact, because in fact we know that they make you incredibly vulnerable, and to attend to those vulnerabilities actually makes you a lot more effective a practitioner, whether you're in emergency services, police, the policing, or a healthcare worker. I think that it's apparent that the media, to refer to what Antoinette was saying in terms of responsible reporting, has a big role to play here. And one of the ways that I think that the world overall and the media have tried to say thank you and recognize the sacrifice that healthcare workers are making is to call them and to refer to them as heroes. We must absolutely appreciate the risk of that, because the way that we understand heroes is that they oftentimes have capes, though they do not have weaknesses and vulnerabilities. And that narrative can really be put on individual nurses who are people, doctors who are people, even porters, that, well, you're a hero, and so you're not allowed to be frightened, and you're not allowed to be scared. And I think, and I've said, I suppose I've discussed this with the two of you as my colleagues, I think that this is one of the places where we actually stand the biggest risk, is the inability to appreciate risk. The inability to say, I actually need to step back. I'm going to make myself and the patient more vulnerable in this particular point. Means that you are more likely to go further, either in treatment or in intervention, that you can and or then you should in a way. So, I mean, I'm being a bit convoluted, though. I think that really the message is about there's a risk that all of the essential workers and how they've been narrated means that there isn't the real and necessary ability to appreciate not only the risk that is involved in it, but the vulnerability that is inherent in it as well, which is exactly, in fact, what you need to do in order to respond to it, actually in order to be a lot more effective, efficient, and in fact, to last the leg of this, what will be a very long process.
It's again coming to the fact that this is, not a race, this is a marathon. And I think the narrative around our healthcare workers and essential workers being heroes is a very important topic. And from a lay person, when we see advertising and campaigns, and especially what's been happening overseas, is that there's this label that our healthcare workers, our nurses and doctors are heroes. And I think from a professional's point of view, and I really would like to unpack this because it's important for us as society to know, how do we actually address it? Maybe Dr. Antoinette, you can really also unpack how perhaps having the heroism or the heroic term can actually be quite damaging and prevent people from coming forward for help.
Yes, I think, in a experience like a pandemic, it's very reassuring to isolate people and call them heroes. But we actually forget that they're human beings, as Zama was saying. And, they've been likened, and some of the messaging from the government has actually been like on target, but some has been slightly off target. So it has been likened to them going into a battle. But we forget they're not soldiers. They're not willing to put their lives on the lines. And they're humans just like you and me and everyone else. And the problem we have with traditionally with healthcare workers, and when I talk to health workers, I'm talking about across the board. I'm talking about nurses, pharmacists, psychologists, everyone. Is the problem with labeling and is that it sometimes maybe is enough to just call them heroes, but then we're missing the whole thing underneath. So the majority of doctors, which I've spoken to, don't feel like heroes. In fact, they might actually feel like lambs being sent to the slaughter. But because they're being called heroes, they feel like they're frauds or imposters. And one of the big issues, which we could also spend a whole webinar talking about, is moral injury, which we are expecting our health workers to find, where on one hand they're being called heroes, and on the other hand they're really feeling like they're not doing a good enough job. I suppose also, how do on the one hand, I think some medical people are, but if we talk about our difficulties, we talk about not being able to get PPE. How do I talk about that when there's this rhetoric as well that your heroes and in public hospitals there's often a media ban on people, healthcare workers, talking out. How can I be a hero? And I've seen some of the comments coming through here when my practice is closed and I'm actually not working. Or how can I be a hero if I've got a vulnerable disease and now I'm sitting at home? So we need to be really, really careful. And I think what people need to understand is that healthcare workers and essential workers, we've been trained to do this. This is our bread and butter. And the rhetoric around it needs to be changed. They need to be supported in different ways. And I think, the only way we can get to ask more of our healthcare workers is if we're giving them what they need from the basic safety levels, and if we are understanding what their struggles are, then we can ask them to fight. But they need to have that underlying support, and it is an institutional support, and it's a systemic support, and it's a support from the public. And even, the clapping at 7 o'clock every night has been great, and the meaning behind it is good. But as I've said to my husband a few times, just give me PPE. You don't need to go clap, So, and I mean, it's a bit of tongue-in-cheek thing, but that's basically where I am. I do feel really strongly about this, because if we are, we're not giving, and healthcare workers are almost impossible to track into and to get into mental health services. And by lauding them, we are making them feel like they're actually weaker. They're weaker. So by saying that they are stronger and these strong people, what happens when they're just feeling human and scared? They're going to feel inadequate, where actually they're just normal. Yeah, it's normal.
Two things. The first one is that I suppose the one time that we can imagine that frontline healthcare workers are like heroes is the loneliness and the isolation that comes with. And I was rattling in my mind, myself being a Marvel Comics fan, about how many heroes actually have a great deal of social support and very few of them. And we need to strike the balance, therefore, in how we're narrating and appreciating this, because it really can cause a great deal of forlornness, of isolation, in a way that is no longer helpful anymore. Not just in the internal experience and the internal feelings of not being able to share your vulnerabilities, of being terrified, but also, as you were saying, Antoinette, in the reality, and I don't think a lot of people know this, in the reality where a lot of people have had to move out of their homes because of the fear of actually contaminating and are literally living by themselves. So this is a really massive, I suppose, factor that we need to consider. Yeah.
And just seeing everyone's comments coming in, and we're definitely going to get to answering some now, and it just shows you what a big topic this is and how much conversation really has to happen in unpacking all of these different complex issues. And I see a lot of people also commenting, and please, if we kind of flippantly say essential workers and healthcare professionals, we're including everyone from those working in the kitchens at hospitals and clinics, who field workers, community healthcare workers, social workers, OTs, porters. It's really across the board. So please don't feel like we're offending you. It's really, we need a much bigger term to incorporate everyone. And I think that brings into two important things that I really wanted to touch on is, as we're seeing the numbers increasing of more and more people testing positive, increase in death rate, we're seeing more healthcare professionals also testing positive. And that means that they have to go into isolation or quarantine. What is the psychological impact? Or you've had companies who've had to close factories because of infection. As we're seeing more and more people testing positive, going into quarantine, leaving their families, what is the
stress responses and post-traumatic-esque stress responses are people who tested positive, had to isolate, had treatment, experienced symptoms, and also had the stigma when they were trying to reintegrate. So the data is there. It was not necessarily new data. It was confirmatory data from the United States when there was the SARS virus there, and very similar things happened there, where both in terms of the terror of having to test positive, the horror of the treatment, and then also the discrimination of stigma. Those three things are, when they come together, can have a much longer term effect that we're going to see towards the end of the year, next year. And we know the thing with PTSD is that it can also be quite difficult to treat, can actually be quite intractable. And it leaves a psychic wound that gets cold in season on season in a huge way. So we need to be attentive to that right now, so that we can hopefully prevent the likelihood of stress responses into the future.
Sorry.
Ooh, Cassie, we've lost you.
Yeah, sorry. I'm back again. Thanks for tech. I think also one of the things popping up already in the comments, and I've seen we've had journalists join us. We have people concerned about teachers. And I want to just touch on the idea that we forget that journalists as well are also working on the front line during this whole time, feeding, having to go on the front line, going on you see the stories and report and speak to people. And they've also lost colleagues. And had to deal with this crisis under very difficult working environments. And perhaps we can also touch on the impact on their mental health during this time, and that we forget that this is a really tough job and a tough position for them too.
Zamal, I think you've had a bit more experience with the journalists and...
Yeah, and I was also looking at the comments, and I think that can I put a topic number 4 for another webinar is specifically to work with journalists. And I think that a great deal of our success, both in terms of COVID Gauteng, the work that we're doing, as well as absolutely the SADC, is our strong partnership with journalism for two real factors. I think historically, it's being able to rely on them in being able to disseminate information. And I think I was saying to a colleague or friend recently that in the last 10 years, the social appreciation for mental health and mental wealth is so much better. And I really have seen it progress because of the reliance and the help of the journalists that we have. And so really thank you for that. There's also something about the recent collaboration that we're doing around working with their mental wealth and health, because it can be so underappreciated that to report on all of this can itself be incredibly traumatic, amongst very many other things. I think there were 2 points that we also wanted to bring forward at this point, is that having a great appreciation of media studies in terms of background, there's something about a developing story where at the best of times you need to keep information going, and sometimes when it dries out, you begin to create information. And that's the burden of journalism. What we are concerned about is that sometimes the creation of that information can lead to misinformation, or it can lead to the bringing together of certain variables which do not absolutely go together. And I think that there's great space and potential for collaboration in this regard, where we can come together and speak about it. For example, on the one hand, we appreciate and have benefited greatly from the journalistic reporting that says frontline healthcare workers are doing a great job. And at the same time, we need to take it further, perhaps, and adjust the idea of heroism, and also say, even after this, it's about saying that these heroes that we were referring to, these are the conditions that they're working under. And this was not reported until this point, for example. Similarly, we appreciate the fact that our journalist colleagues have helped us speak about the necessity to look after your mental health in order to prevent some sort of psychiatric or psychological distress after this. And at the same time, we can collaborate further in saying that not everybody will develop some severe psychological distress. What is normal in this abnormality that you're feeling, and how do you respond to it? How do you empower yourself in a way? And then maybe lastly is there's also, because the journalists are the people that are reporting on frontline healthcare workers and essential workers, they unfortunately are seemingly becoming marginalized or maligned from that group. And of course, they're those people. I think 2 weeks back when one of our big media houses lost a journalist, it was such an important moment, actually, to say that you too are vulnerable, you too are frontline, and that's a message that needs to be put forward. And I know my journalist colleagues are going to not intuitively do that because their role is oftentimes to point the camera forward and not to invert it. And this, and you need to look after yourselves as well.
Yeah. Absolutely. And I think I really want to start going through some of the questions because there's such great discussions happening on the chat. And I'm sure a lot of people are trying to listen and chat. So I want to definitely go to that. And a lot has also come up about teachers. And I really want to remind everyone, next week, Friday, we're hosting another Mel and Guardian webinar specifically around empowering teachers and parents for the back to school, both for the mental health of the educators and the school readiness, as well as for parents, how to prepare your child with going back to school. So please don't miss it. Definitely register and look out for that next week. And we're going to unpack that in a whole discussion. But now to go through some of the questions. And there's some questions here about healthcare workers and frontline staff who have seen a lot more loss and grief and bereavement. And that's really difficult to deal with. And as we see more people dying from COVID, what would be some of your tips, Antoinette? I mean, how do we even manage that really difficult topic?
It is a really, really difficult topic. And I think it's acknowledging, so one of the ways to become a little bit more mentally resilient is to consciously become aware of what you may face. So preparation is useful. And I'm going to talk a little bit about, there's also a few questions coming through about managers and leaders. So it is about preparation from the top down, and kind of gently taking the healthcare workers through what they may experience. What is a normal response? If they are experiencing loss and grief and dying. I mean, South African doctors and clinicians, healthcare workers, we're used to we are used to struggles. However, there is a fear that this is going to be unlike other struggles we've seen. So, I mean, I think Cassie, this is a good time to also speak about the healthcare workers care network that we are all involved in, because I've also seen there's quite a lot of questions on where's the support for the healthcare workers. And so, Cassie, if you can explain a little bit what some of the work we've been doing, which is kind of caring for the carers by the carers. If you could just explain that a bit, and because I see there's quite a few questions of where to get help.
Yeah. And I think it's so good that everyone is also recognizing, and even just from the poll questions where we asked, what do you think is the main issue that frontline workers are facing between PPE, mental health, food, financial, and accommodation? Mental health is 40%. And I think it's such an important priority for us. SADAG has been creating awareness around mental health. The mental health of healthcare workers and frontline staff has always been an issue and something that we've been working on. And I think the opportunity with COVID and learning what's happened overseas and the risk and the impact on the mental health of healthcare workers, we really had to collaborate. And I think one of the magic things that have come out of COVID is really just people coming together wanting to help. And I love people going on the chat saying, how do I volunteer? How do I get involved? How do I help? And a pro bono. And we forget that there's so many people keen to help. So through this collaboration, the Healthcare Workers Care Network has been established and is going to be launched in exactly 10 days. It's going to be live. It's providing a safe space, providing free mental health support to all healthcare workers. So if you work in the kitchen, you're a porter, you're a home-based care worker, you're a doctor or nurse, you would have access to free mental health services. And that includes a helpline, an SMS, a website. In whichever way, shape, or form, we can offer help and support during this time. One of the things that Dr. Antoinette and her team have been working on is even training up hospitals and clinic managers, personnel on how to focus on mental health in the workplace. And I think, we will definitely share those details with everyone. The amazing thing is that we've had over 500 volunteer mental health professionals, from psychiatrists to GPs to psychologists and social workers and counselors, who volunteered to help their colleagues with pro bono psychotherapy. And I think That's just amazing. So I'm really looking forward to launching that. You know, especially in South Africa, we're learning from what's happening overseas is that for a change, we can be proactive and look at preventative mental health. And we're really hoping that this initiative will provide that and make a difference. So yeah, we're really exciting, and we will share the details. You can, so long before while the website is going live, and you can go have a look at covidcaregauteng.co.za for some more information. If you're wanting to stay in touch or getting involved, please feel free to email me on office@anxiety.org.za, and we'll definitely keep you in touch. I just wanted to go through a couple of more questions that have popped up, and there's a few that's come up, Antoinette, about moral injury, and if you can, you know, it's such an essential concept, and perhaps you can just unpack it briefly for us.
Yeah, it's a very important topic, and as part of our team in COVID Care Gauteng, we've got a few people who are dedicated to just watching the research on this topic. It's a little bit hard to understand, but basically, I'm just going to read from a definition. It was first used to describe soldiers' responses to their actions at war. So it's basically when soldiers are asked to do things that are against their moral code. So that's where the term first came from. And it represents failing to prevent, bearing witness to, or learning about acts that transgress deeply held moral belief and expectations. So, you know, I've heard of some hospitals who, you know, there's been a directive that no persons over a certain age will be ventilated. No persons with a certain condition will be ventilated. And, you know, we're asking our healthcare workers to make this call on people who are the same age as them or have the same conditions as them. And that goes against the internal moral code, and that's what we mean by moral injury. It's a really important topic because it leads to such guilt and shame. I've had some experience with that when I did my internship a long time ago, 2001, 2002, with the HIV/AIDS pandemic. We had no treatment. I mean, I was young and naive. I didn't quite know what I was doing, I mean, that stage. But I definitely had moral injury. I definitely felt it. And it was only years later that I was able to identify that that's what it was. So we are seeing moral injury across the world, and it's going to come to our South African healthcare workers. And it's going to be, it's quite a hard topic to unpack, but it's a really important topic that I think if we could get all our healthcare workers knowledgeable about it, then they can reach out, because it's such shame associated with it, and that's the problem.
It just shows that we're also human, and that we're, you know, trying to navigate this. And Zamo, this is another question from Sudha for you that I'd like to pose to you. I'm feeling the responsibility to trying to keep my department of frontline anesthetists is weighing heavily on me. Any advice on how to cope with that feeling of being responsible for my staff? And I think also this is probably, you know, what a lot of managers, you know, line managers are also experience if they're an essential worker. I mean, any tips on how you cope with the responsibility of looking after your staff or your department?
I suppose the occupational hazard answer that I always give is that firstly you need to look after yourself in reality, because already therein is such a great example of the potential for moral injury. There'll be a point where you can, you know, that responsibility is such a huge one, and a part of it you are inevitably not going to meet up to all of it to some degree, and this is, you know, this is why it's so important to appreciate the concept of moral injury in its entirety. And it's really serious. I think that some of the suicides that we've seen from healthcare workers are a direct result of that in a way. So to go back to what I say, the importance is in fact to look after yourself. And this is one of the messages as the COVID Gauteng response team that we are punting is in a way, if we have compassionate leadership, we are going to do better in this crisis. And there are several kind of elements of compassionate leadership and characters. Though earlier this week, it occurred to me that for me, compassionate leadership is when things get hard, you soften.
And I think we've just lost Zamo for a second, thanks to the first one. Maybe you can continue, Antoinette, while we catch up with Zamo again. Sorry.
Okay, so I mean, I think, I think Zamo and I are singing from the same hymn sheets. So in terms of, the big thing is the self-care. The next big thing is what we're promoting is the concept of capable calm throughout the ranks. We are promoting compassionate leadership. And in fact, our team has, the Gauteng team has been very involved. We've probably trained about 600 leaders in different areas and hospitals and doctors. So the person who posted that question is welcome to contact us. This is what we are really trying to do is preventative work. We can help support the people who are supporting the people, the healthcare workers, in terms of training. But there's also lots of resources if you go to our website on different forms of leadership and what is useful and more specifically what is not useful. Just a few simple things, it's kind of having a daily check-in and check out, being honest. So if you're uncertain about something, tell them, I'm uncertain about X, Y, and Z. The not knowing what is uncertain is worse than knowing. Be honest, be compassionate, be interested, have a check-in with all of your staff most days, look out for their mental health needs. And I think it's about bringing teams together, and especially in kind of an anaesthetist will be working in a high-risk environment. They are working with nurses, with the whole big teams, and it's about getting that team to work as one. And that is how we're going to get through this.
Sorry, I lost you there for a second, though just to echo what Antoinette's saying, there was also a comment from somebody who's working in HR, and this kind of leadership training that we're doing is for absolutely those types of questions.
Yeah, and I think that's, thanks for unpacking that. And I think, normally the perception of accessing mental health resources or care or support is often, people assume that it's very time consuming, it's costly, and especially in the essential workers and the healthcare profession, there isn't time to go for counseling, to go for support, and also the money. A lot of doctors, a lot of professionals have lost money, had pay cuts, maybe they're the only breadwinner. How do we manage that with the difficulty or the challenges around accessing mental health within your department, your clinic, your hospital, your company? How do we access that, and how do we improve that going forward?
Do you want to take that, Internet?
So I think, so one of the approaches, and I've thought about this a lot, of how to improve kind of the mental health of all kinds of workers, essential workers, approach. So it needs to be not mandated, but there needs to be an approach from the top saying, we hear you, we get you, we see that you're struggling. If you're struggling more than what maybe you used to, here is a resource that you can help. And all of the hospitals do have EAP programs, and the public hospitals. If you're not comfortable with going through an EA preventative approach and a reactive approach, and you work on both arms simultaneously. So what are you going to do when you've got the person who's really struggling, and then what preventative work can you do? I see there's a question there for COVID care Gauteng, for only in Broken Gauteng. It was set up initially for Gauteng, but drop me an email and I will share you where the national link is. Once our website is live, you'll see that very clearly, but it's for anyone.
Yeah, and I think that's the thing, is we want, through the Healthcare Workers Care Network, through the collaboration with SAMA and SASOP and SISA and SASA and SADAG, is we're really just trying to get as many organizations to also, I think with mental health, is often it works in silos, right, in treatment and accessing care. And I think one of the things, again, is that through this collaboration, and I love seeing how many other people are coming forward with what they're doing in their community or in their way to help other people. And I just urge them, there's such an opportunity to collaborate, and there's such a need for it. I think also one of the things that we can encourage other essential workers, whether they're teachers, whether they're police, they work for department stores or whatever it is to really find out about what mental health support is in place within the company or the organization, the employee assistance program, And I think just another reminder, again, it is under the offers on the side here, that if anyone is needing help or resources or even just referrals, don't forget that StatAg is still available 7 days a week, 24 hours a day, and we can also refer through. I just wanted to touch base, and I know time is always difficult and we've got more questions to answer. Just again, to look at the poll questions, everyone is agreeing that mental health is definitely the priority that needs to be taken during COVID-19. And I think to also help us unpack, Zamo, if we don't focus on mental health during this time, what are the long-term consequences? What are the risks that we're going to see, knowing that COVID's going to be with us for 12, 18 months? If we don't take this seriously, where could we be? What could be some of the consequences?
One of the things we need to appreciate is that this crisis and this pandemic is a leveler. And so one of the things that it does is that it affects us all, right, in terms of the health risk, but also absolutely in terms of the anxiety, the pressure, the degrees of distress that people are facing. And maybe for the first time, you may be experiencing psychological distress, which, if it's your first time, then it's very difficult to know where to go and what to do. Though then we anticipate that if South Africa has a population of approximately 60 million people, whether it's now, towards the end of the year, or in the next year, 60 million people will experience some form of psychological distress. And that's not to say all 60 million people will need to go into hospital or to see a psychiatrist, though definitely a lot of people, this will touch everybody's psychology. Let alone the population that we already work with, psychiatry and psychological population, who are going to be pushed to the bottom of the pile. For example, if you go to a casualties now in Cape Town, if you are having a psychotic episode or you've had some sort of relapse, it would be very difficult to respond to you at this point over somebody who's having difficulty breathing. It's not to say that those people do not need response, and that's the future that we need to start preparing for as well. The last thing that I want to say is that because of time and is that it's important also to consider that really what we're trying to promote is psychological wealth and health. And psychological wealth, like all wealth, requires investments. It requires actually that you have a long-term picture in mind at the best of times, that you put in the resources and the energies now to reap the rewards into the future. And that's absolutely something that we need to be encouraging, both in terms of response to this crisis, the overall generally going forward in our daily lives.
And I think that's such a great message, and thank you for that. And I think one of the big things, Antoinette, from the training that you're doing and the work that you've been doing to create awareness, how do we build resilience going forward in our healthcare professionals, our essential workers? What should we be doing, and how do we begin?
Ooh, that's a loaded question.
No pressure. Sorry.
What should we be doing? So I think in terms of, it's about understanding what resilience is. It's about understanding that a lot of our healthcare workers have already got some form of inbuilt resilience, that the majority of them, the vast majority of them, with the correct support and with the correct understanding of the normal psychological reactions, will get through this fine. But this difference, they need more support if they add in those things. The other big thing in terms of building resilience is, once again, I'm actually repeating what I said right in the beginning. Self-care is not selfish. And the focus always with healthcare workers is on the other. It's always that. And I think this is one time where we need to step back, focus on ourselves, put on our oxygen mask before we put on others, literally. When you're rushing to resuscitate someone, you have to put the full PPE on. You have to look after yourself and then the other, which is slightly different to the way we've always worked. But this is not a sprint. This is a marathon, and in fact, some people are saying it's a relay. We need to take it slowly, and that is how we can build on the resilience healthcare workers already have. But they're going to need to prioritize their mental health, and the best way is various aspects of self-care, which are well widely publicized, what those are.
Yeah, I think that analogy of putting on your own oxygen mask is really important, and visually. And I think the more we can share that and encourage that, whether you're a loved one, a colleague, a family member, is if you know of anyone, whether it is a healthcare professional, frontline, essential worker, everyone needs to be doing something to put their own oxygen mask on. And again, I see all the questions regarding, teachers and preparing children to go back to schools, and this is such an important topic, and that's why we're going to be addressing it next week. So please do join the chat next week to prepare you for going back to school in the next couple of weeks and the impact in the next couple of months. So please know we're going to take your questions and re-ask them next week. So I do hope that you do join us. I think to end, and again, I would love to talk on this topic the whole afternoon. And I think it's important, and I'm really hoping and urging everyone that's joined is that we continue having these conversations. Reach out to the different people who are sharing projects that they're working on, or organizations or services, and let's continue collaborating. Again, let's be part of that relay team, and really starting that discussion behind this. This is just thought-provoking and introducing the topic. Perhaps I could end off, Zamo, to come to you. Any last comments, any last words on the importance of focusing on mental health during this time?
I mean, I think that it's something that we have said, and it's so important to echo that we need to look after those that are going to look after everybody else. It's such a rare thing that we need to be absolutely deliberate about it. And in looking after yourself, you need to be deliberate. One of the things that I've been saying of late is that you need to have a symmetrical response to the distress. So you need to do more than you usually do in order to look after yourself, because there's more distress out there. You absolutely need to have a dedicated, deliberate, symmetrical response to self-care in order to get through this. And we need you to get through this.
Thank you. And that's, great messages. Dr. Murich, any last words from you as in going forward on the topic?
So I think the main points are, we need to take two approaches. We need to have a preventative approach, and we need to have a reactive approach. And that can be applied to whether you're a company, whether you're a team leader, whether you're an individual healthcare worker. You need to put in the work in terms of the preventative stuff, which Zamo just said. And then if there's a problem, we need to react quickly and access services quickly. And then the other thing to realize is this is going to be around for a long time. And we need to pace ourselves. We need to pace ourselves mentally. Managers, leaders who are looking at rosters, who are looking at all of that, they need to be very, very cautious and look out for the long term.
Yeah. And I think, and having everyone comment and just seeing some of the comments and the care and the compassion, it gives me goosebumps, because that's what I think we need more of during this time, is that we need to remember we're all human. So next time you see that police officer or that nurse or a doctor or the transporter, or I think just to be more compassionate, maybe just really ask them, how are they doing? Just be kind. There's a saying, and people have even been saying it in the chat, is that we're all in the same storm, but we're in different boats. And I think it's really important that we try during this time to be more compassionate and to be kinder to each other. And I think definitely doing whatever we can to create awareness around mental health. Just as a reminder, this will be recorded. We will be sharing this with everyone as well, and sharing it on platforms so that we can share it with other people who weren't able to participate in today's discussion. I really look forward to having further chats about this. And just to remind everyone again about the resources that are available, please look up for information that will develop on the Healthcare Workers Care Network that will be launched. And we really encourage you to get involved in whichever space, shape, country, space you're in. Please do. As well as reaching out to SADAG. There's already helplines in place for everyone in the public. We also have dedicated helplines for medical students. Please reach out for help before it's too late. To everyone, thank you so much for joining us from around the world. It's been a great discussion. And to our experts, thank you for your time. And I really appreciate your insight, your heart, and your compassion around this. Thank you once again to Mail and Guardian for hosting us, and to our great sponsors, Dr. Reddy's, for giving us the platform to have these important discussions. Everyone have a great afternoon, and thank you very much for joining us. Bye-bye. Bye-bye.